welcome back to our face-to-face workshop. Today's theme is ODLSS on Diverse Learner Parent Guide for School Reopening. Our presenter today is Erin Miller. And Erin, would you like to introduce yourself?
Sure. Hello, everyone. My name is Erin Miller. I'm a board certified behavior analyst and the manager of specialized behavioral support and strategy with ODLSS. I have over 10 years of experience in the field of education and have held positions as a special education teacher, a behavior analyst, and a behavior consultant in various settings. So I'm excited to share some information with you guys today.
Yes, thank you, Erin, for being here with us. I am going to stop sharing so you can go ahead and give your presentation. Thank you. And you are on mute.
If I do this, does this block the screen at all?
Yes, it does block it.
Yes. Okay. All right. So today we're going to share a little bit on a parent's guide to school reopening. So we'll talk about some of the strategies and supports that CPS has put in place, and also some ways that you can navigate these and some other concerns with your students. So today we'll just talk a little bit about health and safety protocols, some behavior supports, addressing school-based anxiety with our students, and then also some academic considerations. So first we'll go into health and safety. So there's quite a few mitigation strategies that the district has put in place for our students, and these include the use of universal cloth face coverings, social distancing, hand washing and the use of sanitizer, vaccinations and weekly testing, and also stringent cleaning protocols. A couple of things that our parents should know, especially our parents of our special needs learners, is that universal face coverings is one strategy used to stop the spread of COVID-19. And all students and staff are required to wear cloth face coverings, regardless of vaccination status, unless they are eating or drinking or outside and able to maintain at least 3 feet of social distance. Some things that parents should know for cloth face coverings for their students. I know there's a lot of concerns around students who maybe are unable to wear a cloth face covering or have resistance to the sensation of something on their face, whether it's a sensory issue or another issue related specifically to their disability. Students with IEPs and 504s cannot be excluded from in-person learning due to a resistance or difficulty with wearing consistent cloth face coverings, and that schools should implement positive behavior supports to increase cloth face covering wearing. And so they should be looking at specific ways to teach, shape, and reinforce those skills for our students so that they do learn to utilize those important health and safety protocols, but they should never for any situation be punished or removed from the school for resistance or inconsistent wearing of a cloth face covering. All students are eligible to apply for a face covering accommodation, and each situation is evaluated on a case-by-case basis. They do this to make sure that all the students have the supports they need. So if a student maybe just was recently diagnosed with something like asthma, and they are requesting a cloth face covering accommodation, they will also loop in other departments to ensure that the student has all the supports that they need in addition to a cloth face covering accommodation. So they want to make sure that they're covering every single base whenever students are requesting specific accommodations. Another strategy that the district is using currently is maintaining 3 feet of social distance as much as possible. And we are hearing this question a lot, why 3 feet instead of 6 feet? And medical research actually shows that the spread of the transmission of COVID-19 was no more likely when people were 3 feet apart than it was when people were 6 feet apart. So 3 feet apart allow us to have a more consistent school setting, something that's maybe a little bit more familiar to pre-COVID times, and also maintain safety for our students. In any situation where 3 feet of social distance is not able to be maintained because students need direct prompting or support in specific classrooms or specific populations. There is a task-specific PPE that is being centrally distributed to staff members who find themselves in those types of situations. So there's an extra layer of safety there for the students and the staff when those situations cannot be avoided. Also, we know that hand washing is the first line of defense against COVID-19 and was the first line of defense against any germs pre-COVID as well. So hands should be washed with soap and water for at least 20 seconds. And we are encouraging staff and students to wash hands frequently. And these include after entering and exiting the building, after breaks, after blowing your nose, sneezing, or coughing, before and after eating, after using the restroom, and other key times where there may be contact with other potential germs or high flow areas. And so schools are increasing their hand washing procedures and using hand sanitizer. And for a lot of students, these specific protocols will be incorporated into a student's day. So there are specific times that this will happen. And then there's also sanitizer when hand washing is not currently available. I also wanted to just briefly touch on the vaccination and weekly testing that the district has established. The reason that they are encouraging vaccinations for all staff members is to mostly protect our students who are not vaccinated or who are not eligible to be vaccinated at this time. So this is a strategy called cocooning, and it essentially just surrounds students who are not vaccinated or who are too young to be eligible for a vaccination surrounds them completely with people who are vaccinated. So it adds an extra layer of protection. All staff are required to be vaccinated unless they are provided a medical or religious exemption. In that case, they are required to complete weekly testing to ensure that they have not contracted nor are they spreading COVID-19 across the district or the buildings. Now, students 12 and up are encouraged to be vaccinated, but however, vaccinations are not required, and it can be a parent and a student's decision to be vaccinated or not. Parents do also have the opportunity to opt their students in for weekly testing if they would like that additional layer of protection and knowing, and their consent can be revoked at any time. So if any point in time you decide that you don't want your child to continue to be vaccinated, you can revoke that consent at any time. There's also been quite a few questions around the at-home screener. And as you guys have noticed, this is the third day of school and screeners have not been required, but parents are being asked to fill out an attestation form to agree to perform those health screenings while they're at home. And so parents are essentially going to agree that they will not send their student to school if there are any abnormal symptoms. And I've heard this described too, if you know that your student regularly has a specific type of symptom that may be related or maybe fall within the list of COVID related symptoms, but you know that this is your child's norm. You do not necessarily have to keep your child home from school. But if your child wakes up and they are displaying brand new symptoms that are not regular for them, then this district is recommending that students do stay home and symptoms are monitored to ensure that we are not spreading COVID-19. Of course, if your student ever does have symptoms or has been exposed to COVID-19, we are asking that parents do inform the school so that proper contact tracing can be conducted. The last mitigation strategy that is in place is comprehensive cleaning protocols. And so all classrooms and schools are cleaned daily. The district has hired additional custodians to assist in these efforts. In addition, they also have layered mitigation strategies that include HEPA air filters, air quality assessments, hospital grade disinfectant sprayers, sanitizer and soap disinfecting wipes, plexiglass dividers and sneeze guards, and also task-specific PPE. And all of these health and safety protocols are aligned with state, local, and federal guidance. So to get into a little bit more specifics here, we know that our students have been out of school for a very, very long time. And, some returned hybrid last year, but it was still an inconsistent schedule. And so whenever we are coming back to school this year, we really want to ensure that we are focusing most of our efforts on the social emotional well-being of our students. Now, absolutely, we agree that academics are highly important, and decreasing any sort of gaps that have occurred during these closures are also a top priority, but we also want to make sure that our students are okay and that they are ready to learn. And so we know that our students have faced noticeable challenges and barriers over the last 18 months, including but not limited to changes in their daily routine, lack of predictability, increased fears about their safety and the safety of loved ones, extended periods of isolation, potential loss of a loved one, limited access to food or food scarcity, loss of their home or changing living conditions, and safety and security concerns. We know that there are many, many others that some of our students are facing. And so we are expecting to come into this school year as staff, students, and families with a little bit of a different perspective. So we want to make sure that in addition to ensuring that our students have all of the supplies that they need, we also want to make sure that they're supported. So we are bringing patience, flexibility, calmness, mindfulness, humor, cooperation, encouragement, positivity, respect, compassion, and kindness. Not limited to these, and obviously many, many others, but it's really important for us to approach this school year a little bit differently than we maybe have approached the first day of school in the past in pre-COVID times. And we know that our students need this social emotional support more than ever at this time. And so we are working specifically in specialized behavior support and strategy, but also across ODLSS with many other departments across the district. And this includes our partners in the Office of Social Emotional Learning, our related service providers and counselors, special education administrators and district representatives, our assistive technology and AAC department, parent involvement specialists and FACE, and then also our Office of Safety and Security. And we're working collaboratively with a lot of other teams within each of those departments to ensure that our students have all the supports that they need as they return to this school year. And some of those strategies that we are really, really focusing on as a collaborative effort are screening and proactive support. So ensuring that schools are connecting with families early on, just to ensure that if there are supports or services that students need to be connected with due to any barriers or challenges that they have experienced during COVID-19, that we have resources within the school or vendors that we can reach out to support them most effectively. We're looking very much at increasing and making our tier 1 supports robust so that all of our students have the supports that they need when they return to school. We know that there will be students who come back who have never needed a tier 2, tier 3 support or an IEP or 504 previously, but they may be demonstrating deficits in specific areas, whether they're academic, behavioral, or functional. And we want to ensure that these tier 1 supports are as robust as possible so that when our students enter these school buildings, that they are able to access their environment, access education, and social emotional well-being to the greatest extent possible. Now, we know that the tiered 1 strategies will not be the end-all be-all for all of our students, even if we build these up. So we are also focusing on these targeted interventions, and we'll get into what these look a little bit more for our students with disabilities in a moment. But we are looking at these tier 2, tier 3 interventions and working very closely with OSEL and the counseling department to ensure that our special ed voice is loud and clear in all of these strategies and initiatives that are taking place. But also targeted interventions are addressing specifically the functions of behavior and evidence-based best practices. And then our last tier, but not our least tier, of course, is our support for teachers. We know that if our teachers and staff are not in a good place to support our students, then we won't see the same progress that we are expecting. And so in collaboration with OSEL through the Healing Center project, through behavioral health teams, through moving forward together, we are ensuring that our staff also have the supports necessary to be able to support our students most effectively. And I wanted to look a little bit more specifically at these targeted interventions, especially as they relate to challenging behavior. And so we know, again, that our students may come into this school year with behaviors that maybe have not been seen before, or a resurgence of behaviors that had previously been reduced. And so we want to make sure that we have a level of support for each one of those students. And so we have been looking very closely at a couple different supports for those targeted interventions. The first one obviously is our safety plans. So these are ideal for behaviors that are disruptive or dangerous, but maybe happen rarely. And so we want to ensure that if these big infrequent events do occur, that we do have a plan in place to support that student most effectively, using evidence-based best practices and strategies to obviously always prevent those behaviors from occurring or those situations from occurring. But if they do occur, we want to ensure that we have a robust plan in place to make sure that that student is supported most effectively. And so mostly these are done at the school-based level. By counselors or case managers or special education teams. But these safety plans can be a really great intervention for these behaviors that are infrequent, but also can be disruptive to student learning. If our students are seeing behaviors or demonstrating behaviors for the very, very first time, whether they have an IEP or 504 or not, we can always look at tiered interventions through our MTSS model. And so that includes a tier 2, tier 3 behavior support plan, which uses a lot of the same strategies that's found within a behavior intervention plan in an IEP or 504, but also uses those tiered interventions and helps the students move through the tiers. We want to make sure that our schools understand, our families understand that they don't necessarily, once they enter a tier for intervention, it doesn't necessarily mean that they stay in that tier. And so the tiers can be fluid. And so we want to make sure that we are using all of the great resources and strategies through MTSS, through our OSEL department, to ensure that we're meeting our students' needs most efficiently and effectively. The final targeted intervention that we can really focus on here is our FBA and BIP. And this is best for behaviors that are repeated, behaviors that maybe have a longer history. And so we use strategies to actually assess the function or the purpose of those behaviors and develop behavior intervention plans for our students. And these are just for students with 504s or IEPs, where the other plans can be incorporated into a 504 or IEP, or they can be a standalone document as well. And so I wanted to talk a little bit about when behavior plans should be considered. So if a student had a behavior plan before the pandemic, one thing that we know about behavior is that it's contextual, and it's specific to the environment and to the stimuli or the events that are occurring within that environment. And so we want to ensure that if a student had a behavior plan prior to the pandemic, that we are checking to make sure that that behavior plan is still effective for that student. And so we are asking school teams to take a little bit of progress monitoring data at this beginning of the school year to determine if this plan is still effective, if any sort of modifications or adjustments need to be made to the plan, or if the school team potentially needs to consider developing a brand new FBA and writing a new BIP to support the change in potential student behavior. If a student became eligible during the pandemic, we would definitely encourage school teams to conduct a new FBA. And the reason behind that is that if the students participated in hybrid learning, if the students were learning at home during that time, that environment is very, very different than 5 full days of learning in a school environment. And so we want to make sure that that behavior plan is most effective for that student and is related to the specific environment that they are learning in at this time. And so we would recommend a new FBA to determine if a new BIP is necessary, and if behaviors are either at the same level or have changed in any way, whether reduced or increased, so that those student behaviors are addressed as a preventative and proactive strategy. One thing that I think I always want to highlight about FBAs and BIPs is that they are not just when behaviors have gotten out of control or just when behaviors are very, very challenging, but these can be used as proactive and preventative ways to identify why behaviors are happening, and teach new appropriate behaviors. And so these can be used at the very early signs of challenging behavior. And then we've got our third category of students, and these are students who maybe have never demonstrated challenging behavior before, but they are coming back to the school year, and we are seeing brand new behaviors from them. And this is not something that we are not expecting. So we know that throughout this time period, our students have all, no matter who they are, no matter how old they are, no matter where in the city they live, they have all experienced some sort of trauma throughout this event. And throughout the pandemic, we have added other bad news and stress and unpredictability to their plates. And our students are coming back to school, and they may encounter a minor inconvenience, something that we would think would not really trigger challenging behavior. But with all of these other things that they're carrying on their plates, all of these other things that they are carrying on their shoulders, we may see challenging behavior. And to some of us, it may look like a complete overreaction, but we really want to look at all of the other factors that are contributing to this behavior. And that's where our behavior intervention plans and behavior support plans can come in to be really, really handy. And so if you are starting to see behavior for the very first time from a student, we do recommend that the school team consider a behavior support plan through MTSS or a behavior intervention plan, whichever seems most appropriate to the student. Parents have the right to request those if they are seeing challenging behavior, or they're hearing from their student that things in school maybe don't seem to be going the way that they were anticipating. So as parents, it is your right to be able to request these and collaborate with your school teams on how they think that these could be addressed most effectively. I also wanted to address a couple thoughts about anxiety, especially as it relates to returning to school. So again, we know that this is going to be a bigger transition than usual. So back to school always is a big deal. It always is a big transition for all of our students. But this year is going to be especially different, especially for our students who have been out of school for an extended period of time. And so we are hearing things like, my child is scared to come back to school, and how will students be made to feel at ease? And so we are ensuring that as students return after this global pandemic, that staff are really focusing on connections and relationship building with our students and refamiliarizing students to school and classroom routines. Being at home is very, very different than being at school. Being remote is very, very different than being in person. And so some of our students may need a little bit of a refresher. And so we should really focus these first couple of weeks on really getting to know our students, letting them get to know us, and also refamiliarizing them with school routines and expectations. It's also really important too for students to have some shared responsibility in that. So if teachers are so inclined to be able to have students help develop some of those expectations for the classroom or ways to support them most effectively, we know that having that buy-in increases cooperation, and then also helps students feel like their opinions are valued. And so, we know that as students return back to our buildings, that there are some differences in schools, but our teachers are trying to ensure that the day-to-day procedures and the environments resemble the school before the pandemic. And then staff will also have the opportunity to speak with students regularly about their concerns. And that's where relationship building comes in to play and becomes so important, is if the student has a trusted adult, they are more likely to share how they feel about coming to school and if they have any concerns. And then also being able to discuss and reinforce the importance of those health and safety protocols and why they are in place and how they can support that student most effectively. We're also hearing a lot of questions around how can I encourage my child to follow precautions at schools without alarming them? And these are things like social distancing and wearing a cloth face covering. But we know too that even prior to the pandemic, the best way to protect against germs and illness was to follow proper hygiene practices like hand washing, like using hand sanitizer. And so our teachers and school staff will make sure that they're scheduling these into students' routines and that they are following these protocols after recommended times, like eating, like using the restroom, like being out on the playground, to kind of help reduce the potential for spread of COVID-19. Some other ways that they can encourage students to participate in these different protocols and precautions include things like singing songs while washing hands, allowing students to earn points, stickers, or tokens for washing their hands for the proper amount of time or washing their hands at expected times. Also, things like using a task analysis or visuals to support proper hygiene so that students can do this independently as much as possible. Some of the other mitigations like cloth face coverings and social distancing, these are also extremely important and valuable. And we know that reinforcement is the best way to improve the use and shape the use of these different strategies. And teachers and staff will be providing things like social praise and reinforcement for adhering to these strategies and trying to make these practices fun by using play, having students put cloth face coverings on stuffed animals or other characters within their classroom, drawing them on worksheets, practicing wearing them during times that are most enjoyable so that they get that reinforcement and they're able to participate in wearing that cloth face covering and pairing it with a preferred activity. Also doing things like just increasing the length of time that students wear that cloth face covering. So maybe they're able to tolerate it for 5 minutes. Maybe the next day we gradually increase to 6 minutes. And we build from there. And through the entire process, we want to make sure that we are reinforcing our students, that we are making these positive experiences for them, so that they are seeing these as not scary things that they have to engage in, but positive, healthy practices. We also hear that students are anxious about being around others. And so how can we make them feel more comfortable? And this is something that parents can do as well, but bringing your students outside of the home and letting them engage with other people in safe environments like parks, like taking walks, like maybe eating outside at a preferred restaurant. Parents can also potentially walk their child around the school, talk about fun memories, and try to help them pair those old memories with the transition that is happening this week, so that students are a little bit more comfortable with getting back into those old routines. We also want to make sure that parents are okay. Again, we know that if our caregivers are not in a good place, that we're probably not going to see some of those same appropriate strategies for our students. And so some of those things are, don't be afraid to talk about COVID-19. Not talking about something actually sometimes makes those thoughts a little bit more persistent, a little bit bigger, and sometimes we make our own assumptions about them. So ensuring that we are talking to our kids about COVID-19, about the importance of different health and safety precautions, and using some trusted resources like the CDC, like the Illinois Department of Public Health, to be able to provide facts around the current situation of COVID-19. We also want to make sure that we're acknowledging our own anxiety. So if you have specific anxiety about your children returning to school, about COVID-19, a lot of times those anxieties can be projected onto our kids. So I'm not saying not to share your feelings, but I am saying be cautious about what you share around your students so that they do not have unnecessary fears about the world around them. We can also focus on what we are doing ourselves, right? The only behavior that you are truly in control of is your own behavior. So making sure that you feel empowered and you know what you can do to keep yourself and others safe. So talk about different strategies that are in place and different things that students can do to ensure their own safety while they are out in the community or while they are at school. And the last piece too is just to ensure that we're watching for different signs and symptoms. If our students are demonstrating different behavior, whether it's shutting down or it's acting out, we do want to make sure that we are sharing that information with our school teams so that they can make sure to connect our students with the resources that they need within the building or within the community. So we never want to let these things kind of fester, especially now when we know that so many of our students are fragile and that they've experienced so much over these last 18 months. We want to make sure that our students are able to be connected to those resources early on to be able to have the best effect. I also wanted to briefly touch on some academic considerations as students transition back into the school environment. And these include cohorting. So I know in previous years, as we transitioned back into hybrid learning in the different phases of reopening last school year, we were talking a lot about pods and keeping students in small groups of pods. The guidance has changed a little, and the district is now implementing a cohorting procedure. And this is keeping students within their classes as much as possible in these stable groups to minimize exposure to other students. And so you may notice that your students are eating lunch in their classrooms, and that is just trying to keep those students who are in contact with each other most frequently from being in direct contact with other groups of students within the building. Now, every school is following the policy for cohorting, but it may look different depending on your student's grade and LRE. So if you have a student who moves to many different classes or is compartmentalized, cohorting may look a little bit different for those students. Also, if you have students who maybe receive related services or direct service minutes from a special ed teacher or another related service provider, cohorting may look a little bit different for those students. So be sure to reach out to your school teams and ask them what those procedures look like specifically for your students and how those instructional minutes are being implemented per the student's IEP or 504. Also, there's been a lot of questions around grading and what will grading look like this year. I know that there was a lot of different guidance that came out kind of on a rolling basis last year as different things developed and as we continue to phase our students back into learning. But some important things to think is that students will receive grades on class assignments and progress toward curriculum standards. For our students with IEPs or 504s, their instruction should be specifically designed to meet their specific needs. However, they should not necessarily be graded on their IEP goals and benchmarks. They are still graded along the same continuum as their general education peers, but their specifically designed instruction is intended to bridge gaps so that they are able to meet those same expectations as their same age peers. And so grading will be fairly traditional this year. The only caveat would be if your student has different promotion criteria or grading criteria outlined within their IEP, and the school teams will follow that procedure for those students that have that listed. Also wanted to address briefly quarantine. I know that there's been a lot of questions from parents around this as well. And so there are quarantine procedures in place if students are in contact with COVID-19. And so there are two different ways that this could happen. One is a full quarantine, and that the teacher is providing virtual instruction to students who are remote. So the whole class is remote, and the teacher will continue to provide instruction remotely. And so everything will transition back over to those Google Classroom platforms and Google Meets as they did at the beginning of closure 2 years ago. There's also the individual or small groups under quarantine. And so the teacher will provide that virtual instruction to those students who are remote due to quarantine, and provide simultaneous instruction to those students who are still in person. Some things to note is that Google Suites will continue to be the platform used for any sort of quarantine situation. The teachers will provide coursework that is aligned to the current class instruction, aligned to standard and responsive to the needs of our students with diverse needs, like our students with special education and our students who are English learners. Work will not be necessarily considered late if students are quarantined, and makeup time will be provided to complete those assignments. In the event that a student is unable to access virtual instruction from home, schools should offer non-digital coursework. So if you are a family that really struggles with consistent technology or Wi-Fi access, non-digital coursework can be sent home to the student during that quarantine. And they will have the opportunity to meet with their teacher using other platforms as necessary. If a student joins a virtual classroom, they will be marked present virtually. If a student does not join virtual instruction, they will be marked absent as they would if they did not arrive to a physical school building on a day of in-person instruction. And so just at a final note, welcome back. We are so excited to welcome families and staff and students back to Chicago Public Schools, and we are wishing everyone a very happy and healthy and successful year. I'm happy to stay on and answer any specific questions that people may have for the remainder of the time.
Yes, so thank you for that that wonderful presentation and all that information. I think as a CPM parent myself, I really wanted to get a little bit more clarity on the protocols that they were doing, especially on the cleaning one. And I know I did have a question in regards to the mask. Now I know you said it depends and differs on different type of classes, but are all schools providing face masks for students or just whoever forgets them? You're on mute. I'm sorry.
That I unfortunately I don't know the answer to. I know previously students were all provided with free cloth face coverings. And I'm not sure if those were redistributed at the beginning of the school year or not. But I do know that there are disposable cloth face coverings that are available at each school building, but I'm not 100% sure about the distribution of those cloth face coverings.
No, that's fine. Thank you for that. And thank you for this wonderful information again. I think we're gonna go ahead and close off the meeting, unless you had anything else to add on to your presentation.
No, that was really all I had.
Yes, thank you for that. And thank you everybody for joining us.